Welcome, and thank you for tuning in for the Partnership Lake Houston's State of Healthcare virtual event with Dr. Peter Hotez. He's Dean of the National School of Tropical Medicine at Baylor College of Medicine. Hey, thanks for being with us today. Our show sponsors, we have a couple. Presenting sponsors of today's luncheon are HCA Houston Healthcare, Kingwood, and also Memorial Hermann Northeast. Our platinum sponsors today include the Auberge at Kingwood. Our gold sponsors are Lake Houston YMCA, University of Texas MD Anderson Cancer Center, and we also have some silver sponsors, Community Resource Credit Union. Our bronze sponsor include 9-round, 30-minute Kit Box and Fitness. I hope I said that right. Vital Heart and Vein, and of course, Walgreens. I'm your MC today, surprise. I'm Sam Schrade, CEO of DNA Studios, and also your outgoing board chair. Our illustrious board chair, Terry Vaughn, couldn't make it today, and so I was in the wrong place at the wrong time. Here I am. We're glad that you are here with us today. Today, Dr. Hotez is going to update us on the COVID-19 vaccine and distribution, as well as the pandemic and how it has transformed the state of healthcare. He's going to be here to answer questions submitted by our viewers as time allows. So please put your questions in the comments and things like that. We'd love to be able to answer the questions that you have. We have a lot of time allotted. You will notice that currently you are muted, and all guests will remain muted throughout the program. So if you have questions, please use the Q&A function located at the bottom of your screen. And we encourage you to go ahead and enter your questions now. Don't wait till the end of the event or the end of the program. So we are very grateful to have support of our presenting sponsors, HCA Houston Healthcare and Memorial Hermann Northeast. We are now about to hear a message from John Corbeil, CEO of HCA Houston Healthcare, Kingwood, Texas. Roll that video.
YMCA, the Lake Houston Area Chamber, and many other community events. And you'll see our new brand that we rolled out in 2019. When I think about things that really make me proud the most of being CEO here, it is absolutely about the quality of care that we provide. We really want to be able to be home, highest quality care. Right now, we're number one.
No audio. All right, unmute me. Come to me. All right. Stand by with the technical difficulties while we rack that up. Let me give you a little personal testimony about this great event today. Several years ago, in fact, almost 8 years ago, when my wife Casey was pregnant with Emma. She had some complications, in fact, big complications. And one morning we woke up and had to rush to HCA Kingwood. And fortunately, miraculously, her OBGYN was already at the hospital and decided very quickly in order to for the health of both baby and mom to pull our baby out early. And so they took fantastic care, and our baby was delivered wonderfully with no issues. We spent several weeks in neonatal at Kingwood, HCA Kingwood. And man, the care that we got was so wonderful. And mom and baby are doing fine. And many of y'all know little Emma, and she's 8 years old now, doing great. But it really made me reflect a lot about the healthcare that we have in our area. And that area is something that we could get to very quickly here in the northeast part of Houston. And so not only do we have great doctors and great facilities here in the Lake Houston area, but we had to spend a month in going back and forth into neonatal. So what a great convenience that was, that we didn't have to drive all the way downtown, pay to park and things like that. So we're very thankful. We were also able to send an award to our doctor as well, back when we gave awards for our healthcare providers. And so we're very, very grateful for that. All right, are we gonna go back to Justin? Okay, here we go. Second time's a charm. We can't wait to hear from Justin Kendrick. No, back to Josh. John, take it away.
Hello, I'm John Corbeil, and it's my honor to be the CEO here at HCA Houston Healthcare Kingwood. Over the past 2 years that I've been here, we have seen astronomical improvement across the board when we look at service excellence, quality improvement, growth in our partnership with our providers, and our involvement within our community. 2020 is definitely a year that none of us could have planned for, and how fitting is it that it is the year of the nurse. When I think about our frontline colleagues and the selflessness and the things they do each and every day, it personally inspires me as well as the team. Miraculous things happen every day, even to the point where we identify where our nurses each and every day after their hardest days go home and take care of their family members. They go to that sporting event after school. They do all these things, and then a miracle happens. They come back the next day to continue to serve our patients here within our community. We're proud sponsors of the YMCA, the Lake Houston Area Chamber, and many other community events, and you'll see our new brand that we rolled out in 2019 across the entire area. When I think about things that really make me proud the most of being CEO here, it is absolutely about the quality of care that we're providing to our community. We really want to be able to be the reason that you do not have to leave home for the highest quality of care in the world. Right now, we're #1 in the entire HCA Houston Healthcare Division out of 14 hospitals for clinical excellence, which is a culmination of many quality initiatives. And I'm extraordinarily proud to announce that we're #1 in all of HCA out of nearly 180 hospitals in mortality and complications. When you think about our core business, that's exactly it. It's saving lives and preventing harm. In 2021, I look forward to continued expansion here at our campus. We'll be adding a 38-bed heart hospital, an additional cath lab, a $3.5 million OR renovation and refresh, as well as a hybrid lab construction as we continue to support our higher complexity cardiology patients. We look forward to many other capital expansion projects here at the facility, totaling over $40 million. I'm extraordinarily proud to be the CEO here. I look forward to our continued success and look forward to ways that we continue to support the community. Thank you.
He's such a great investor with our community, and definitely with Partnership Lake Houston. We thank you for your staff, and Devin and all you guys over there doing a great job. We really appreciate it. Also, we're really grateful to have a message from Justin Kendrick, CEO of Memorial Hermann Northeast. Before I toss over that way, I want to give a special shout out to a Memorial Hermann Northeast retiree, Tom Broad, who I know is on this call. He's already told me that I looked good, so I got to give him a shout out. You can give me a shout out if you want to get your name in on this event as well. But Tom said my makeup looked really nice, which is great since I'm not wearing any, so no worries. But let's toss it over now to our good friends over at Memorial Hermann Northeast.
Good morning. Welcome to Partnership Lake Houston State of Healthcare. Memorial Hermann Northeast is proud to provide support as a co-presenting sponsor for this event. The extraordinary events of the past months have required an incredible amount of patience and flexibility from all of us. Though the fight against COVID-19 is far from over, we have come so far since the pandemic began, and I know we are all eager to return to our new normal. However, until the virus is subdued and vaccination levels reach herd immunity, daily life is likely to be defined by efforts to manage the pandemic. As forces beyond our control dictate our day-to-day lives, the rules and norms may change rapidly. Changes in how we think, behave, and relate to one another, some deliberate, but many made unconsciously, some temporary, but others potentially permanent, are already coming to define the post-pandemic normal. Throughout the changes and many challenges, the one thing that remains steadfast is Memorial Hermann's commitment to the health of this community. While continuing to adapt to a dynamic healthcare marketplace and evolving consumer needs, Memorial Hermann Northeast has simultaneously moved forward with strategic plans and initiatives that have positioned us well to do what's right for our customers and the communities we serve. In addition, while we care for our community, we have also made sure to take care of our own caregivers by creating an infrastructure and resources to support physicians, nurses, and all team members so that they, in turn, remain resilient and can continue to provide the highest quality care for your loved ones. As we navigate our new normal, I encourage you to stay informed and ask questions. The most up-to-date and accurate information you can trust will come from the Centers for Disease Control and Prevention. And of course, Memorial Hermann has a dedicated COVID page on our website, where you can find the latest information on vaccines, hospital visitor policies, and other useful resources. It's a challenging time, but I'm inspired by the countless examples of our community coming together, businesses providing support to those in need, and neighbors caring for each other across our nation. This gives me great confidence that we will get through this period of our history together, just as we always have. Let us continue to keep each other, our loved ones, friends, and neighbors in our thoughts and prayers.
Once again, thank you to all of our premier sponsors. They make our events happen. Also want to let you know about our platinum and gold sponsors for today's event are is it Auberge at Kingwood? Auberge at Kingwood, great. Our Lake Houston Family YMCA and the University of Texas MD Anderson Cancer Center. Our silver and bronze sponsors today for today's event are Community Resource Credit Union, 9-round, 30-minute kickbox fitness, Vital Heart and Vein, and Walgreens. Our organization relies on the partnership of businesses in the Lake Houston area. In March and April of this year, we were fortunate enough to welcome top investors, Frost Construction Company, JSL Foods, K&D Renovations, ProCare Collision, and Vital Heart and Vein. But we also welcomed a bunch of new people, Brocker Autos, CIFA Capital, Decided Excellence Catholic Media, Eden Salon Suites, Elizabeth Robertson Realtor, and Hair Central by Georgia, Iona Flooring, Kingwood Pressure Washing, LLC, Megaton Brewery, Norton Lilly International, Pharmacy Tech Lessons, and Turnkey, Pro Custom Service, QMJ Properties, Sweet and Sassy Kingwood, The Sarah at Lake Houston, Transformation Outreach Center, and VIP Technology Services, LLC. Thank you to all of our sponsors. It's been a great honor to have you guys part of today's event. Now it is my honor to introduce you all to our speaker today. Dr. Peter Hotez is an internationally recognized physician, scientist in neglected tropical diseases and vaccine development. Hotez is the Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he's also the coordinator of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. Thank you, Dr. Hotez. If you have a question, please submit it through the Q&A feature in Zoom or on Facebook. We will do our best to respond to each question addressed either by asking Dr. Hotez live or through a text response in the Q&A platform. While we wait for your questions, I'd like to take this time. Nope, we're going to toss to him. Ready to go. Fantastic. Dr. Hotez, we've seen your face all over TV. We are so glad that you're with us. Take it away.
Well, thanks so much. It's good to speak with everybody. I'm here in Houston at the Texas Medical Center and talking to you from my office where at Baylor College of Medicine. What I could do, maybe talk for about 15, 20 minutes, kind of giving an overview of where I think we're headed in terms of COVID-19 and some of the challenges that we face, and then use the rest of our time to answer questions. I think that might be a good way to go. I'm going to try to share some slides with you, and I'll try to not inundate you with too many slides, but just to give you a sense of where we're headed right now. So as you might have heard, we are now in the middle of our fourth wave, and hopefully this fourth wave will be much tinier than anything we've seen before because we are vaccinating a large segment of the U.S. population. We're now at about overall about 50 to 60% of the U.S. population's gotten a single dose, and around 40 to 50% two doses, fully vaccinated. And that's really important, provided we can continue on that trajectory with the goal from the Biden administration to vaccinate 70% of adults. And the urgency for this is the reason for accelerating the timeline is because we're dealing with this very aggressive new variant of the COVID-19 virus called the B.1.1.7 variant that first arose out of the United Kingdom late last year and is now the dominant variant in the US, including here in Texas. And the problem with this variant, it's higher, more transmissible, and it's causing greater morbidity and mortality as well. And it's affecting a lot of young adults as well. So this narrative that young adults don't need the vaccine or adolescents don't need the vaccine is based on old information and not really reflective of this very aggressive B.1.1.7 variant. So as we head into June, and we're almost there, we should start to hit about 60% vaccination rates across the country, and the cases will continue to trend downward. And I made this slide about a week ago before the CDC released its revised vaccination guidelines. And I said, well, when that happens, then the CDC will release version 3.0 of vaccination guidelines to liberalize things so that if you're vaccinated, you don't have to wear masks. And I think the CDC maybe jumped the gun a little bit. I would have held off, until sometime in the middle of June. I can't fault them too much. But so we have a lot to look forward to. And then we had written a paper on the right saying that once we hit 75% of the population being vaccinated by July or August, then transmission will really decrease dramatically, and life will start to resemble the way it did in pre-pandemic or the way it did in 2019. And you got to love Twitter. I said life will start to resemble 2019, and people on Twitter objected, saying 2019 wasn't such a great year after all. But fine, you pick the year, it should look more pre-pandemic, with some exceptions. Car travel will increase, domestic air travel will start to go up, and it already is. If you've been to an airport recently, you can see it, the flights are really packed. But there are going to be some limits because we're not vaccinating the rest of the world. So we're vaccinating the US and now Canada and the UKs, the Nordic countries, Western Europe, and Israel. And that's really about it. And so there are going to be limits to our economic growth, particularly for the oil and gas industry, which depends on full-on international business. So that's going to be a big problem for us. The next version is trying to fully expand the economy is going to depend on us vaccinating internationally as well, so we can do full-on business with Africa and Latin America. And then what I'm asked about is what happens after that. And the answer is we don't know. It's a brand new virus, but a couple of thoughts. This is from a model from a friend and colleague, Mark Lipsitch, who's at Harvard School of Public Health, who published a very good paper early on in the pandemic suggesting that we were going to see peaks every January. And he was certainly right about that horrible peak that we had last January. And I think that's a possibility again. So even though we are vaccinating our way out of this epidemic in the Northern Hemisphere, in the US, North America, and Europe, we might anticipate that there will be peaks of virus coming back, whether same or similar variants. So the reason I say that is, even though I think we can fully open things up this summer, there might be periods of instability every January when we'll ask people to put masks back on or dial back some of the loosening of restrictions, possibly in January. So don't be too surprised by that. And we may see new variants coming in from elsewhere. ZA means South Africa, BR means Brazil, and those are the two of the variants of concern that I'd be worried about. So this may mean we may need you to get a booster vaccine later on in the year. So if you've gotten, for instance, 2 doses of the Pfizer, BioNTech vaccine or Moderna vaccine, you might expect a 3rd immunization later on this year, early next year. And if you got a single dose of the J&J vaccine, you might expect a 2nd dose. And what that booster will do is a number of things. One, it'll give you higher levels of virus neutralizing antibody, which is how all these vaccines work. It'll extend the durability of protection, and it'll be reconfigured to tackle some of these variants. And then the question I'm asked is, well, does that mean we're going to need to get vaccinated every year for these January peaks? And the answer is, we don't know. I don't think so, actually. I think once you get that 3rd immunization later on this year, next year, that may be it for a while, for a few years. But there's disagreement in the scientific community. For instance, the CEO of Pfizer is already talking about combining the COVID booster with influenza vaccine, with the possibility of doing an immunization every year. So I don't think that'll be necessary, but we'll see how it pans out. I think the other thing that I'm a little concerned about here in Texas in the southern United States is this. Here's where we were this time last year. We were at the very bottom of our epidemic, the nadir in terms of cases. And then if you remember what happened last summer, we saw this big rise in July and August, and that was pretty devastating for Texas and the southern United States. So there was the southern sweep of coronavirus. Well, here's where we are now. And then the question is, will we see another surge over the summer? So there's a lot of complacency right now. People think we're out of it. And I would say in the southern part of the United States, I'm holding my breath because I am worried about the surge. Now, it won't be as bad because we do have some people vaccinated, and we do have some people that are infected and recovered and therefore partially resistant. But overall, we're underachieving in terms of vaccination here in the southern part of the United States, and I'll show you that map in a minute. So I am worried potentially about another southern surge in this part of the country. So and if you notice, this is what the southern surge looked like last summer. And as I said, I don't think it'll be as bad, but this is what the vaccination map looks like. This is from the Mayo Clinic, and it's basically saying, if you look at the areas that are underachieving in terms of vaccination, it's the southern states overwhelmingly. Some extent, Idaho and Wyoming are not doing well either. So the Northeast is rapidly progressing towards full vaccination. The southern states are lagging behind considerably, on some cases just half the rate in the Northeast. So I do think our part of the country is vulnerable to that southern surge, and that's something that we're going to have to give a lot of attention to. And we also have the problem that globally, the United, by comparison, overall, the US is doing extremely well. Same with the UK and Western Europe and the Nordic countries. Basically, no one is getting vaccinated on the African continent, and many parts of Southeast Asia and Latin America are also underachieving. So there is that huge vulnerability there that we have to think about. And the problem is this: the scale is just extraordinary. We have to vaccinate 1.1 billion people in sub-Saharan Africa, 650 million people in Latin America, 400 million people in the smaller low-income Asian countries. It's more than 2 billion people, 4 to 5 billion doses of vaccine. And the question is, well, where does that come from? How are we going to get those doses produced? Because it's unclear whether the two mRNA vaccines that we're using mostly in the United States can be scaled to that level, because it is a brand new technology. So it becomes an engineering problem with a brand new technology like this. So this is one of the concerns that I have, is that we went so heavy on the innovation and made some very good vaccines. I got the Pfizer, 2 doses of the Pfizer BioNTech vaccine, and I'm grateful for that. But I sometimes think we, went so heavy on the innovation, maybe we should have had some of the older technologies out there as well, that are simple and durable and unfussy, and that could be rapidly scaled for low and middle income countries. And that's what we do. So our Texas Children's Center for Vaccine Development, we've been here in Houston for about a decade. And we started 20 years ago, developing low cost recombinant protein vaccines for a lot of parasitic infections, neglected diseases. And then about 10 years ago, we began making coronavirus vaccines for SARS and MERS, because we knew they were going to be a problem. And sure enough, when the COVID-19 sequence became available in early January 2020, we hit the ground running to make a recombinant protein vaccine for COVID-19. And you might say, well, what does recombinant protein vaccine means? It means it's a sort of an older school technology that's the same as that's used to make the hepatitis B vaccine all over the world. And the point is, it's easy to scale up, and there's a lot of capacity for producing our vaccine globally. So we began by licensing it to non-exclusively to Biological E, which is one of the big vaccine producers in India. And this is our Center for Vaccine Development. It's co-headed by myself, and Marilena Patazzi has been my science partner for the last 20 years. And we make these group of what are sometimes called anti-poverty vaccines, because they're vaccines that not only improve public health, but because these are debilitating conditions, they actually cause poverty. And then we added that coronavirus vaccine program. So our recombinant protein vaccine, which is produced in yeast, Pichia pastoris, which is the same technology used for the hepatitis B vaccine, on alum, together with the CpG oligonucleotide from Dynavax, is now in phase 3 clinical trials in India. Looks really great in laboratory animal challenge models, and the phase 1, phase 2 data look really promising. So we're holding our breath, and we think this vaccine could be released for emergency use authorization in India over the summer, and then hopefully globally. And Biologically has the ability to produce over 1 billion doses, simple refrigeration, and it builds on that 40-year track record of safety based on the recombinant hepatitis B vaccine, and therefore potentially suitable for children and infants, and it's inexpensive. We think we could do this for $1.50 per dose, so we think it'll be one of the lowest cost COVID vaccines that are out there. I'll just finish just a few words about this problem of vaccine hesitancy. And this has been a growing issue that's affected the country. And it began back 20 years ago, when there were a lot of false information claiming that vaccines cause autism. And I got involved in this because I'm not only a vaccine scientist, but my youngest daughter, Rachel, has autism and intellectual disabilities. And I wrote a book called Vaccines Did Not Cause Rachel's Autism that went up against the claims of the anti-vaccine groups, and they keep on changing. And unfortunately, in the last few years, it's become more of a political movement, initially linked to the far right wing of the Republican Party, the Tea Party, under this banner of health freedom, medical freedom. But now it's really accelerating. And I think when you look at the numbers, this is accounting for the very high rates of people refusing vaccines in the southern part of the country. So I think this is something that we're also going to have to work on, and how to reach out to conservative groups to try to convince them to get vaccinated, because otherwise I think this virus is going to continue to circulate in the southern part of the United States. And my colleagues at Houston Methodist have now been sequencing some of these virus variants, and we're already seeing additional mutations pop up on the B117 variant. So this is going to create an ongoing problem, and whether or not we can successfully vaccinate the country is going to depend on trying to address this. So let me stop there and use this time to answer questions and see what people are thinking.
That's great. Excellent information. Lots of questions, so stay tuned. First and foremost, the first question, that just to clarify, someone gets their 2 vaccines and now they're wondering if they are absolutely immune to COVID-19. Your response?
Well, the answer is probably. It really depends on a couple of things. One, if you're immunocompromised, if you're a transplant survivor and are on immunosuppressive therapy, or a bone marrow transplant. So this, you might say, well, gee, how many people is that? It turns out there's about 3 to 5 million Americans on immunosuppressive therapy of one form or the other. And that, so it's unclear how well protected those individuals are. Certainly better than nothing getting vaccinated. But if you're not an immunosuppressive therapy, the numbers say that you should have a 95% reduction in risk of getting symptomatic illness, and about a 90% reduction in even asymptomatic infection as well. But it's not zero, and so that's another key point. So the thing that has to be done is not only to get vaccinated to dramatically reduce the likelihood you're going to go to the hospital, but also getting everybody vaccinated in order to halt transmission. And then we can fully open up the country. And that second part has been problematic in where we are right now. At least Texas is a little better than our southern neighbors to the east, but there are pockets of Texas that are pretty low as well. So I think that's the big unknown at this point.
Thank you so much. Another question to piggyback off that: if you have had both of your vaccines, the question is, can you still be a carrier of the COVID-19?
And the answer is yes, but dramatically reduced likelihood. So about 90% reduction in asymptomatic transmission. And what that effectively means is, and the mechanism of that is, when you get vaccinated, you're developing antibody, and that antibody actually gets into your nasal secretions in your mouth, and that stops virus shedding. So even if you get the infection, you have a dramatically reduced risk of transmission. Again, it's never to zero. And, on that basis, the CDC is actually starting to think, well, if that's the case, then why are we still testing people if they're vaccinated? Can we stop testing? And in the workplace or in Major League Baseball, you heard about the New York Yankees, maybe even if they were fully vaccinated, they were tested positive. Well, they might be tested positive, but the risk of transmitting the virus is dramatically reduced. So maybe we should stop routine testing in Major League Sports once people are vaccinated, and in the schools. And I think that's going to be the next version that you'll see coming from the CDC.
Good. That affects us, those of us who work in sports. Oh. A lot as we
By the way, as an Astros fan, the fact that all those Yankees had to be quarantined for an extra couple of weeks, that didn't bother me too much. I can only say that to this group. I can't say that to anybody else. But but it's true. I think we may not need to do that kind of testing, and so I think I think that the message is we're not we're only now learning about all of the what I call performance features of the vaccines, how impressive they really are, and not only stopping you from getting sick, but also stopping virus shedding. I think the hard part of the message is that it's not 100% guarantee, right? No vaccine is. And so this kind of creates a lot of confusion. And so what I say is there's really 2 parts to this story, which is getting vaccinated to keep you out of the hospital, but also getting everybody vaccinated to really dramatically halt community transmission. So everyone's kind of high-fiving themselves, saying, yeah, look, we're out of this. Number one, we're not. I mean, there's still a significant level of virus transmission going on. I mean, remember at this time last year, when we saw those numbers go up 25, 30,000 new cases a day in the US, we were really worried. So that's what we've brought it down to, but we're still not out of this. And I'm worried about that surge in the South because we're doing so badly in terms of vaccination.
Other questions are about adolescents and children. So now that they're eligible to take the vaccine, what are some of the risks that a lot of people have worries and want to know more understanding, especially how it affects to maybe kids going through puberty, or other issues as well. What would you say to those people that are interested in getting more information about vaccinating children?
Yeah, so we've got now data both from the Pfizer BioNTech vaccine and now for the 12 to 15-year-olds, because before it was only released for 16 and up. And today, Moderna just released information for the 12 to 17-year-olds, and it's giving really good levels of protection. They're smaller studies. So, for instance, the Moderna studies are on 3,700 individuals. 2/3 got the vaccine, 1/3 placebo, 100% protection, which is great. But but the numbers are still small, and the safety data looks about the same. There's a lot. We have to remember there's a lot of misinformation out there, including the anti-vaccine groups are really piling on. So they made this claim that the HPV vaccine that for cervical cancer and other cancers causes infertility, and now they're trying to make the same similar statements about the mRNA vaccines, and there's just no evidence for that. So your adolescent is at risk, and I'm a strong advocate for getting adolescent kids vaccinated.
Looking down the road, do you have any question is what will the vaccine schedule resemble? Something that you have to maybe do once a year, every 5 years, every 10 years?
Yeah, so I tried to talk about that a little bit in my remarks. I think once we get that third dose later on this year or next year, that may be it for a while. And then you might say, well, what does a while mean? Well, I think several years. It may not be forever, but I think, and we may need a boost, say 4 or 5 or 6 years down the line. I don't think we're going to need a booster every year, but I can't promise that yet because, again, it's a brand new technology, so we don't have all of the information. So my opinion is that we probably won't need annual vaccinations, that we may not need another vaccination dose after you get your third immunization for another 5-6 years. But it's really important to emphasize there's no data. So my opinion is just that, just opinion.
Concern about other countries and making vaccines affordable and available to them. We've seen prices down to $1.50. Will that be available? Do you think that will help to get the vaccine to these poverty-stricken nations?
Yeah, that's my hope, that our vaccine can come in and be sort of that low-cost people's vaccine, as some call it, for Africa, Latin America, and Southeast Asia. And we're getting some support now for the Coalition for Epidemic Preparedness Innovation. But right now, Biological E, has potentially the capacity for 1 billion doses, but not 4 to 5 billion doses. So we still need other players to come in to help us produce at that scale.
All right, one final question, unless we see some more. This is about those who have had COVID-19. What are maybe your top 5-10 residual effects that you're seeing of people that have had COVID-19?
Well, first of all, if you've had COVID-19 and recovered, your immunity is still incomplete, and our recommendation has been to get vaccinated. Go ahead and still get the full vaccine series. That'll give you more durable protection. So you're right. We have seen a lot of long-term debilitating effects, even among young adults who get COVID-19, even those with not severe symptoms. And so what we're seeing is heart palpitations, shortness of breath, so exercise intolerance. We're seeing neurologic effects, what some people are calling brain fog, where they feel like they're just not on top of their game, and and extreme fatigue. We're also seeing unipolar depression as a manifestation. So, and it's not rare. Up to about 30% of people who get COVID have those long-term debilitating symptoms, and that's why when people say, "Well, why do I need to vaccinate my adolescent or young adult because the death rate is so low?" It's true, but there are a lot of other things going on other than death that really give us pause for concern. So. A number of clinics now and a number of medical centers. I see Memorial Hermann behind you and HCA. I don't know what they're doing particularly, but many medical centers now opening up long haul COVID clinics to deal with this because it's not rare. Again, 30%. And so we're talking about tens of millions of Americans.
All right, last question, and then we'll move forward. We really appreciate you being with us today, but Dr. Hotez, as a professional, as a researcher, as a doctor, what is your recommendation to those who that have not been vaccinated yet and that are hesitant to be vaccinated? What is your doctoral recommendation to those?
Well, the message is no matter, what kind of good shape you're in or any other reason that you have, the only thing that will ensure that you are not likely to go into the hospital or an intensive care unit from COVID-19 is to get virus neutralizing antibodies in your system through 2 doses of the vaccine for the Pfizer, Moderna, and a single dose for the J&J. Otherwise, you're putting yourself or your family members at risk because we're not out of this. I am concerned about another peak of COVID-19, and there's no reason. The vaccine is available now for anyone who wants them or wants to get it, and that's the best way you can be guaranteed to protect your health.
One more question. If you've had COVID, how long should you wait to get the vaccine?
Well, the statement that CDC has made is that it's unlikely you're going to get reinfected within 90 days after getting COVID. So definitely, after 90 days, but I think you could probably get it much sooner. So after a few weeks after you've had it, I see there's no reason why you have to wait, and you can go ahead and get vaccinated.
Fantastic.
But if you have any, obviously with all of this, it's not one size fits all. You want to check in with your healthcare provider as well. And that's going to be really important.
But sometime after 90 days, you can consider it. That's great. I do want to give you an
the
opportunity.
point is even before 9, even so, the point is the CDC is saying it's unlikely you'll get reinfected before 90 days, but it doesn't mean you can't get vaccinated before 90 days, if that makes any sense.
Sure. All right. This has been some great information. I do want to toss it to you one last time. Any final thoughts and any other things you would like to say before we wrap up?
I think the final thought is, now the mental stress for these last year and a half is not to be underestimated. So be kind to yourself, be kind to your boss, and be kind to your employees, because they've been through a lot. And so even though things are starting to open up, people are returning to work, I think, people are still very skittish. That's what we're seeing. And so this is a time for great understanding and compassion. This has been a brutal year for everybody. Everybody's rethinking things, and this is a time to be extra kind to your family and friends and colleagues.
The Dr. Peter Hotez, the one and only. We are so thankful for your time today and for the information that you're giving. It's very, very timely information as we come out of this pandemic. It's been an incredible year, and we will once again thank you for your time, and hope you have a great afternoon. So we appreciate it.
Thanks so much. Bye-bye.
Our platinum sponsor today, once again, is Auberge at Kingwood. And it's a community specially designed to serve the needs of individuals living with Alzheimer's disease, or dementia, and other forms of memory loss. The communities are specifically designed to nurture their residents through their industry-leading Spark Lifestyle program that provides daily activities, chef-inspired cuisine, medication management, 24/7 staff, and much more. They're located off 59 near HCA Houston Healthcare, Kingwood Hospital. Our gold sponsors today are Lake Houston Family YMCA, always doing great stuff for our community. Thank you, Lake Houston YMCA. And also doing equally wonderful stuff, the University of Texas MD Anderson Cancer Center, the world famous MD Anderson Cancer Center. Thank you for being a sponsor of today's event. The Lake Houston Family YMCA is a purpose, not a place. Join the Y and make an impact with us that allows us to provide resources that support academic achievement, safety, and water safety to prevent drowning. They also help prevent childhood obesity and disease prevention, plus social equality. Now, the University of Texas MD Anderson Cancer Center in Houston ranks as one of the world's most respected centers focused on cancer patient care, research, education, and prevention. MD Anderson is one of only 51 comprehensive care centers designated by the National Cancer Institute and is ranked #1 for cancer care in the U.S. News and World Report's Best Hospitals survey. All right. We want to thank everybody for your Q&A. I think it has been a fantastic thing. Thanks again, Dr. Hotez, for participating in our virtual event today. And thank you to everyone who has joined in our online meeting. Hey, fortunately, today's session was recorded and it will be available on our social media platforms shortly. We'd once again like to recognize our sponsors, co-presenting sponsors, HCA Healthcare, Houston Healthcare Kingwood, and Memorial Hermann Northeast. I feel like a weather person. It's kind of cool here. Our goal, our platinum sponsor, the Albers at Kingwood, gold sponsors like Houston Family YMCA, MD Anderson Cancer Center, silver sponsors, Community Resource Credit Union, bronze sponsor, 9-round, 30-minute Kickbox Fitness, also Vital, Heart and Vein, and the one and only Walgreens. All right, so great news, everyone. This will be our last virtual luncheon. Yay! Last one. Breaking news, last virtual luncheon. So be on the lookout for registration to open for next month's in-person luncheon, which is our State of the State. You got that right. Next month, in person. Don't forget to join us also for the Tascasita BizCom on June 10th at 11 a.m. That one we will still be on via Zoom because the schools need us to do it that way for a little while, but we'll be working on that. So don't forget, you can go to lakehouston.org today and register to receive the link for this meeting. We've enjoyed our time with you here today and look forward to seeing you next month in person. Yay, Sunday. No, that's actually on a probably Tuesday. That is all. No more of my face. Go get some lunch and spread the good word. We'll be seeing you in person. Thanks.